Today, we are diving deep into a condition that affects the very wiring of our bodies, peripheral neuropathy. Let's get right into it. You know that feeling, right? That weird tingling or numbness? But what if it doesn't just go away? What if it's your body trying to tell you something bigger's going on? And turns out, this is way more common than you might think. About 1% of all adults worldwide are dealing with this. And once you get over 60, that number jumps up to somewhere between 6 and 10%. So yeah, a lot of people are feeling this. So what exactly are we talking about here? Well, put simply, it's damage to your peripheral nerves. Those are all the nerves outside of your brain and spinal cord. The best way to think about it is like this. Your body is a house with complex electrical wiring. Neuropathy is what happens when that wiring gets frayed or damaged. Now, here's what's really fascinating about how this works. The condition is what's called length dependent. It means the longest wires in your body, the nerves that have to travel all the way to your toes, are usually the first to act up. That's exactly why symptoms so often start way down in the feet and then, over time, can creep up the legs and even into the hands. So this brings us to the big question, right? Why is this happening in the first place? What's actually causing all this damage? Let's play detective for a minute. When you look at the breakdown of causes, one thing just jumps right out at you. For more than half of all people with peripheral neuropathy, the whole story begins with diabetes. Then you've got about a quarter of cases where, honestly, we just don't know the cause. It's called idiopathic. And the rest is a mix of other factors. And that diabetes connection is huge. I mean, think about this. Diabetic neuropathy is actually the 5th most common neurological reason for disability across the entire globe. It is a massive, massive piece of this puzzle. But diabetes isn't the whole story, not by a long shot. Other things can play a major role too. We're talking about certain chemotherapy drugs, or even, and this one might surprise you, getting way too much vitamin B6 from supplements. Chronic, heavy alcohol use is another big one. And sometimes, it just runs in the family, with genetic conditions like Charcot-Marie tooth disease. Okay, so with all these different things that could be causing it, how in the world do doctors actually figure out what's going on? Let's walk through the path to getting some real answers. The good news is the process is actually pretty logical. It all kicks off with a doctor really listening to your story and doing a thorough physical exam. Testing your feeling, your reflexes. After that, it's usually on to some key blood tests to check for the common culprits, like diabetes or vitamin deficiencies. And if things are still a bit murky, there are nerve studies that can literally measure the electrical signals in your nerves. And those nerve studies, they are absolutely crucial. They don't just say, yep, there's a problem. They help figure out what kind of problem it is. Is the damage to the actual nerve fiber, the axon, or is it to the protective coating around it? Getting that detail right is a really big deal for getting the diagnosis right. So once there's a diagnosis, we get to the most important question, right? What can actually be done about it? This brings us to the management plan. The strategy here is basically a two-pronged attack. On one hand, you've got to go after the root cause. That might mean getting blood sugar under control or stopping a particular medication. And on the other hand, you have to manage the symptoms themselves, especially the pain, and try to prevent other problems like injuries you might not feel. Now, when it comes to that pain, which can be really, really tough, doctors have a few go-to tools in their toolbox. These often include some anti-seizure medications like gabapentin and also certain types of antidepressants that have been shown to help quiet down those overactive, misfiring nerves. The whole goal is to just turn the volume down on that pain. But, and this is a big but, we have to be realistic here. The source material is very clear about this. Pain often persists. For a lot of people, these medications just don't get the job done completely, and that can be incredibly frustrating. You know what, though? That very frustration, that challenge, is exactly what's pushing science forward. The fact that this pain is so hard to treat is fueling some amazing innovation and giving people new reasons to be hopeful. So what does that new hope actually look like? Well, take a look at this number, 79%. Here's the story behind that number. In a recent clinical trial, a staggering 79% of patients who had painful neuropathy from diabetes saw their pain cut by at least half after getting something called high-frequency spinal cord stimulation. I mean, come on, that is a total game changer. It really points to a future with much better options. Okay, we've covered a lot of ground here. So after this quick tour of peripheral neuropathy, what are the absolute most important things to lock in? All right, let's nail down the takeaways. First, neuropathy is common nerve damage, and it usually starts in the feet. Second, remember that diabetes is the #1 cause, but it's not the only one. Third, getting a diagnosis is a step-by-step process. Fourth, managing it means hitting it from 2 angles, the cause and the symptoms. And finally, and this is so important, while a complete cure is rare, managing the condition well can make a world of difference in your quality of life. So we'll leave you with this idea. Think of your nerves as your body's own personal internet. If that network starts sending you glitchy, strange, or even painful signals, it's probably a good idea to listen up. So the real question to think about is, what are the key questions you should be ready to ask your doctor?